Introduction to Acupressure. Acupressure is an ancient healing art that uses finger pressure on specific points on the body to promote health and well-being. It is based on the same principles as acupuncture, but without the use of needles. This non-invasive technique aims to restore balance and harmony within the body's energy systems. By applying pressure to these points, practitioners can stimulate the body's natural healing processes. It is a gentle yet powerful method that has been practiced for thousands of years. Acupressure can be used for a wide range of conditions, from pain relief to stress reduction. Understanding its fundamentals is the first step towards mastering this therapeutic art. The core concept of acupressure involves the manipulation of qi, or vital life energy, which flows through specific pathways called meridians. When this flow is disrupted, illness or discomfort can arise. Acupressure seeks to clear blockages and regulate the flow of qi, thereby alleviating symptoms and supporting the body's inherent ability to heal itself. This holistic approach considers the interconnectedness of the mind, body, and spirit. It is often used as a complementary therapy, enhancing the effects of other treatments. Learning acupressure provides a valuable skill for personal health and helping others. Historical roots and philosophy. Acupressure's origins are deeply intertwined with traditional Chinese medicine, TCM, dating back over 2,000 years. Ancient texts like the Yellow Emperor's Classic of Internal Medicine describe the Meridian system and the therapeutic application of pressure. Early practitioners observed that pressing certain points on the body could relieve pain and influence internal organs. This empirical knowledge was meticulously documented and passed down through generations. The philosophy behind acupressure is rooted in the ancient Chinese understanding of the universe and the human body. It views health as a state of balance between opposing forces and energies. This historical context provides a rich foundation for contemporary practice. The development of acupressure was not isolated, but part of a broader system of Chinese healing arts, including herbal medicine, dietary therapy, and qigong. These practices collectively aimed to maintain and restore the body's natural equilibrium. The philosophical underpinnings emphasize harmony with nature and the interconnectedness of all living things. Illness was often seen as a disruption of this natural order, and feeling involved realigning with it. Understanding these ancient philosophies is crucial for a deeper appreciation of acupressure's therapeutic potential. It highlights a holistic approach that addresses the root cause, not just the symptoms. Acupressure versus acupuncture. While both acupressure and acupuncture stem from the same theoretical framework of traditional Chinese medicine, TCM, their primary difference lies in the method of stimulation. Acupuncture utilizes thin, sterile needles inserted into specific acupoints to stimulate the flow of qi and blood. This invasive technique requires extensive training and is typically performed by licensed practitioners. The needles are left in place for a period, often with gentle manipulation, to elicit a therapeutic response. Acupuncture is widely recognized for its effectiveness in pain management and various chronic conditions. It is a precise medical procedure that targets specific physiological responses through neural pathways and energetic channels. Acupressure, on the other hand, employs manual pressure, typically using fingers, thumbs, elbows, or specialized tools on the same acupoints. This non-invasive approach makes it accessible for self-care and for those who may be apprehensive about needles. The pressure applied can range from gentle to firm, depending on the point and the desired effect. Acupressure is often preferred for its safety and ease of application, making it suitable for a broader audience, including children and individuals with needle phobias. Both methods aim to balance the body's energy, but acupressure offers a gentler, more approachable alternative for many. The choice between them often depends on individual preference, condition severity, and practitioner availability. Benefits and applications. Acupressure offers a wide array of benefits, making it a versatile therapeutic modality. One of its most recognized applications is pain relief, particularly for headaches, neck and back pain, and menstrual cramps. By stimulating specific points, acupressure can help release endorphins, the body's natural painkillers, and reduce muscle tension. It is also highly effective in managing stress, anxiety, and improving sleep quality. The gentle pressure can induce relaxation, calm the nervous system, and promote a sense of overall well-being. Many individuals find it a valuable tool for enhancing mental clarity and emotional balance. Beyond pain and stress management, acupressure is applied to address various other health concerns. It can aid in alleviating nausea and vomiting, especially during pregnancy or chemotherapy. Digestive issues like indigestion and constipation can also be improved through targeted acupressure. Furthermore, it supports the immune system, boosts energy levels, and can even help with respiratory conditions such as asthma and allergies. Its non-invasive nature and minimal side effects make it suitable for a broad demographic, including those seeking complementary therapies for chronic conditions. The versatility of acupressure makes it a powerful tool for holistic health. Yin and Yang theory. The concept of yin and yang is a fundamental principle in traditional Chinese medicine, TCM, and acupressure, representing the complementary and interdependent forces that govern the universe and the human body. Yin embodies qualities such as darkness, cold, stillness, femininity, and interiority. Yang, conversely, represents light, warmth, activity, masculinity, and exteriority. These two forces are not opposing, but rather mutually transformative, constantly interacting and balancing each other. Health is viewed as a dynamic equilibrium between yin and yang, where neither dominates excessively. An imbalance can lead to illness or discomfort, manifesting in various symptoms. Understanding this duality is crucial for diagnosing and treating conditions within TCM. In the context of the human body, specific organs, body parts, and physiological functions are categorized as either predominantly yin or yang. For example, the front of the body, the lower body, and internal organs are generally considered yin, while the back, upper body, and superficial structures are yang. Similarly, conditions characterized by cold, dampness, or deficiency are yin, whereas those with heat, dryness, or excess are yang. Acupressure aims to restore this delicate balance by stimulating points that either nourish yin or subdue yang, or vice versa. This theoretical framework guides practitioners in selecting appropriate points and techniques to address specific imbalances. It provides a holistic lens through which to view health and disease. Five-element theory. The five-element theory is another cornerstone of traditional Chinese medicine, providing a comprehensive framework for understanding the interconnectedness of nature, the human body, and disease. It posits that everything in the universe, including our bodies, is composed of five fundamental elements: wood, fire, earth, metal, and water. Each element is associated with specific organs, emotions, seasons, colors, tastes, and even sounds. These elements exist in a dynamic cycle of creation, Sheng cycle, and control, K cycle, maintaining balance and harmony. Understanding these relationships helps practitioners identify patterns of imbalance and select appropriate therapeutic strategies. It offers a holistic lens to assess health beyond isolated symptoms. In the human body, each of the five elements corresponds to specific organ systems. For example, wood is associated with the liver and gallbladder, fire with the heart and small intestine, earth with the spleen and stomach, metal with the lungs and large intestine, and water with the kidneys and bladder. Emotions like anger, wood, joy, fire, worry, earth, grief, metal, and fear, water, are also linked to these elements. An imbalance in one element can affect others, leading to a cascade of symptoms. Acupressure practitioners use this theory to diagnose underlying energetic disharmonies and select acupoints that can restore balance within and between the elements. This intricate system allows for highly personalized and effective treatment plans. Qi and meridians. In traditional Chinese medicine, TCM, Qi, pronounced Qi, is the fundamental life force or vital energy that animates all living things. It flows throughout the body, providing nourishment, warmth, and protection, and enabling all physiological functions. When qi flows smoothly and abundantly, health and vitality prevail. However, when the flow of qi is obstructed, deficient, or in excess, it can lead to pain, illness, and emotional distress. Understanding the concept of qi is central to acupressure, as the therapy aims to regulate and balance its flow. It is the invisible engine that drives all bodily processes. Meridians are the intricate network of invisible pathways or channels through which qi circulates in the body. There are 12 primary meridians, each associated with a specific organ system, e.g., lung meridian, liver meridian, and several secondary meridians. These channels run symmetrically on both sides of the body, connecting the surface to the internal organs. Acupoints, the specific locations where acupressure is applied, are situated along these meridian lines. By stimulating these points, practitioners can influence the flow of qi within the corresponding meridian and organ system, thereby restoring balance and promoting healing. Visualizing these pathways helps in understanding the targeted nature of acupressure. Meridian System Overview. The meridian system is an intricate network of energy channels that forms the foundation of acupressure and acupuncture. There are 12 primary meridians, each named after a major organ, such as the lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidney, pericardium, triple warmer, gallbladder, and liver meridians. These meridians are paired, with one yin and one yang meridian running along each limb and torso. They form a continuous circuit, ensuring the balanced distribution of qi throughout the body. Each meridian has a specific pathway, starting and ending at particular points, often at the fingertips or toes. Understanding these pathways is essential for effective acupressure application. Beyond the 12 primary meridians, there are also 8 extraordinary meridians, which act as reservoirs of qi and blood, regulating the flow in the primary channels. These include the governing vessel and conception vessel, which are particularly important. Each primary meridian also has specific functions, influencing not only its associated organ, but also various physiological and emotional aspects. For instance, the liver meridian is linked to anger and vision, while the kidney meridian is associated with fear and willpower. Learning the general course and functions of these meridians is crucial for identifying imbalances and selecting appropriate acupoints to restore harmony and promote healing. This comprehensive system guides targeted therapeutic interventions. Locating acupoints. Accurate location of acupoints is paramount for effective acupressure treatment. Acupoints are specific spots on the body, often found in depressions, along muscle grooves, or near bones, where qi tends to gather. They are typically measured using kun, a proportional unit based on the individual's body dimensions, ensuring personalized accuracy. For instance, 1 kun is the width of the thumb at the knuckle. This proportional measurement system accounts for variations in body size, making the points universally applicable. Palpation, or feeling for specific sensations like tenderness, warmth, or a slight indentation, is also a key skill in locating points. Precision enhances the therapeutic effect significantly. To effectively locate acupoints, practitioners must develop a keen sense of touch and a thorough understanding of anatomical landmarks. Visual guides and anatomical charts are invaluable tools during the learning process. Practice on oneself and others is essential for developing the tactile sensitivity required. When palpating, one might feel a slight pulse, a change in tissue texture, or a sensation of dull ache or warmth, indicating the correct point. It is important to apply gentle pressure initially and gradually increase it, always being mindful of the client's comfort. Mastering acupoint location is a foundational skill that directly impacts the success of acupressure therapy. Pressure techniques. Applying the correct pressure technique is as vital as accurately locating acupoints. The most common techniques involve using the thumb, index finger, middle finger, or elbow, depending on the point's location and the desired intensity. Pressure should be firm but gentle, gradually increasing to a comfortable level for the recipient. it's important to apply steady, sustained pressure rather than poking or rubbing. The sensation should be a dull ache, warmth, or tingling, but never sharp pain. Communication with the recipient is key to ensure comfort and effectiveness. Different points may require varying degrees of pressure, from light touch to deep compression. This nuanced application is crucial for optimal therapeutic outcomes. There are several specific pressure techniques used in acupressure. The thumb press involves using the pad of the thumb to apply direct, sustained pressure. The finger press uses the tip of the index or middle finger, often for smaller or more sensitive points. Circular massage involves applying pressure while gently rotating the finger or thumb in small circles. Kneading uses the knuckles or palm to work larger muscle areas. Each technique serves a distinct purpose, aiming to either stimulate, disperse, or tonify qi. Mastering these techniques requires practice and sensitivity, allowing practitioners to adapt their approach to individual needs and conditions. The goal is always to facilitate the body's natural healing response through appropriate stimulation. Common acupoints for pain relief. Several acupoints are particularly renowned for their effectiveness in pain relief. One such point is Li4, large intestine 4, located on the back of the hand between the thumb and index finger. It is a powerful point for headaches, toothaches, and general body pain. Another crucial point is GB21, gallbladder 21, found at the highest point of the shoulder, midway between the neck and the shoulder joint. This point is excellent for neck and shoulder tension, stiffness, and headaches. Applying firm, sustained pressure to these points can often provide immediate relief. It is important to remember to apply pressure bilaterally on both sides of the body for comprehensive treatment. These points are often among the first learned by acupressure students due to their broad utility. For lower back pain, BL23, bladder 23, and BL40, bladder 40 are frequently used. BL23 is located on the lower back, about 2 finger widths from the spine at the level of the navel, while BL40 is in the center of the crease behind the knee. These points help to relax muscles and improve circulation in the lumbar region. ST36, stomach 36, located just below the kneecap on the outer side of the shin, is a versatile point known for boosting energy and relieving various pains, including knee pain. Understanding and correctly applying pressure to these common points can significantly alleviate discomfort. Always consult a healthcare professional for chronic or severe pain. Acupoints for stress and anxiety. Acupressure is highly effective in calming the nervous system and reducing feelings of stress and anxiety. One of the most powerful points for this is PC6, pericardium 6, also known as Neiguan, located on the inner forearm, about 2 finger widths above the wrist crease between the 2 tendons. This point is widely used for nausea, anxiety, and motion sickness. Another calming point is HT7, heart 7, or Shenmen, found on the wrist crease, on the pinky finger side, in the hollow, just below the bone. HT7 is excellent for insomnia, anxiety, and emotional distress. Gentle, consistent pressure on these points can induce a profound sense of relaxation. These points are often recommended for daily self-care routines. For general relaxation and grounding, GV20, governing vessel 20, or Bai Hui, located at the very top of the head, is a key point. It helps to clear the mind, reduce dizziness, and promote mental clarity. CV17, conception vessel 17, or Shanzong, found on the center of the breastbone at the level of the 4th intercostal space, is known as the Sea of Tranquility. Pressing this point can relieve chest tightness, anxiety, and emotional imbalances. These points, when stimulated, help to regulate qi flow, calm the spirit, and restore emotional equilibrium. Regular practice can significantly improve resilience to stress and promote a more peaceful state of mind. Acupressure for headaches. Acupressure is a highly effective non-pharmacological approach to alleviating various types of headaches, including tension headaches and migraines. One of the most popular and potent points is Li4, large intestine 4, located in the web between the thumb and index finger. Applying firm pressure to this point can help relieve pain in the head and face. Another crucial point is GB20, gallbladder 20, found at the base of the skull, in the hollows on either side of where the neck muscles attach. This point is excellent for tension headaches, neck stiffness, and even mild migraines. It is important to apply pressure bilaterally and consistently for optimal results. These points work by promoting circulation and relaxing tense muscles. For frontal headaches, GV20, governing vessel 20, at the top of the head, and Yin Tang, located between the eyebrows, are particularly useful. Yin Tang is known for its calming effect and can help relieve sinus pressure associated with headaches. For temporal headaches, at the sides of the head, GB8, gallbladder 8, located above the ear at the hairline, can be effective. Self-acupressure for headaches can provide quick relief and reduce reliance on medication. It is crucial to identify the type of headache to select the most appropriate points. Regular practice can also help prevent headaches by maintaining balanced energy flow. Always seek medical advice for persistent or severe headaches. Acupressure for digestive issues. Acupressure can be a powerful tool for alleviating a range of digestive complaints, from indigestion and bloating to constipation and nausea. ST36, stomach 36, also known as Zhu San Li, located 4 finger widths below the kneecap and 1 finger width to the outside of the shin bone, is a master point for digestive health. It strengthens the stomach and spleen, regulates qi, and boosts overall vitality. Applying firm, sustained pressure to ST36 can help relieve abdominal discomfort, improve appetite, and support healthy digestion. This point is often used to harmonize the entire digestive system. Regular stimulation can lead to significant improvements in chronic digestive problems. Point. Another effective point for digestive issues is PC6, pericardium 6, or Naguan, located on the inner forearm, 2 finger widths above the wrist crease between the 2 tendons. This point is particularly famous for relieving nausea, vomiting, and motion sickness. For constipation and bloating, ST25, stomach 25, located 2 finger widths on either side of the navel, is highly beneficial. Applying gentle, circular massage to ST25 can stimulate bowel movements and reduce abdominal distension. These points work by regulating the flow of qi in the digestive meridians, promoting proper organ function and alleviating discomfort. Always consult a medical professional for persistent or severe digestive problems. Acupressure for insomnia. Acupressure offers a gentle and natural way to improve sleep quality and combat insomnia by calming the mind and relaxing the body. HT7, Heart 7, or Shenmen, located on the wrist crease, on the pinky finger side, in the hollow just below the bone, is a primary point for sleep disturbances. It helps to calm the spirit, reduce anxiety, and promote restful sleep. Another effective point is Anmian, a pair of points located behind the ear, midway between the mastoid process and the occipital bone. These points are specifically used to induce sleep and alleviate restlessness. Applying gentle, sustained pressure to these points before bedtime can significantly improve sleep onset and duration. Consistency is key for long-term benefits. For deeper relaxation and to quiet an overactive mind, SP6, spleen 6 or Sanyin Jiao, located 4 finger widths above the inner ankle bone, is a powerful point. It nourishes yin, calms the spirit, and helps with various sleep-related issues. Ki3, kidney 3 or Tai Si, found in the depression between the inner ankle bone and the Achilles tendon, also helps to calm the mind and strengthen the kidneys, which are associated with sleep in TCM. Gently massaging these points can help prepare the body for sleep by promoting a sense of peace and reducing mental chatter. Always consult a healthcare professional for persistent insomnia to rule out underlying medical conditions. Acupressure for respiratory health. Acupressure can be a supportive therapy for various respiratory conditions, helping to ease breathing, reduce congestion, and strengthen lung function. LU1, Lung 1, or Zhongfu, located on the outer chest just below the collarbone, is a primary point for lung health. It helps to open the chest, relieve coughing, and improve breathing. Another important point is Li4, large intestine 4, found in the web between the thumb and index finger, which can help clear nasal passages and relieve sinus pressure, often associated with respiratory issues. Applying gentle, rhythmic pressure to these points can promote better airflow and reduce discomfort. These points are particularly useful during cold and flu season. For asthma and shortness of breath, Ren 17, conception vessel 17, or Shenzhong, located on the center of the breastbone, is highly effective. It helps to open the chest and regulate qi flow in the lungs. BL13, bladder 13, located on the upper back, about 1.5 ton lateral to the lower border of the third thoracic vertebra, is a specific back shu point for the lungs, helping to tonify lung qi. Applying pressure to these points can alleviate symptoms like wheezing and chest tightness. Acupressure should be used as a complementary therapy and not replace conventional medical treatment for severe respiratory conditions. Regular practice can help maintain respiratory vitality and resilience. Acupressure for women's health. Acupressure provides gentle yet effective support for various aspects of women's health, addressing issues from menstrual discomfort to menopausal symptoms. SP6, spleen 6, or Sanyin Jiao, located 4 finger widths above the inner ankle bone, is a highly versatile point for women. It helps regulate menstruation, alleviate cramps, and support reproductive health. Another important point for menstrual pain is LV3, liver 3, or Taichung, found on the top of the foot in the depression where the bones of the big toe and second toe meet. This point helps to soothe liver qi stagnation, often associated with PMS and painful periods. Regular stimulation of these points can bring significant relief and promote hormonal balance. For menopausal symptoms like hot flashes and night sweats, KI3, kidney 3, or Tai Si, located in the depression between the inner ankle bone and the Achilles tendon, is beneficial as it nourishes kidney yin. CV4, conception vessel 4, or Guan Yuan, located 3 finger widths below the navel, is a powerful point for strengthening the reproductive system and overall vitality. It is often used for fertility support and to alleviate fatigue. Acupressure can also be used during pregnancy for morning sickness, PC6, and labor induction, SP6, Li4, but only with professional guidance and near-term. Always consult a healthcare provider for specific women's health concerns, especially during pregnancy. These points offer a natural way to support women's unique physiological needs. Acupressure for children. Acupressure is a particularly gentle and effective therapy for children, offering a non-invasive way to address common childhood ailments. Due to their delicate energy systems, lighter pressure and shorter treatment times are generally recommended. Parents can learn simple techniques to help their children with issues like colic, digestive upset, sleep problems, and anxiety. For colic and digestive discomfort, gently massaging points around the navel, ST25, or on the inner forearm, PC6, can provide relief. Children often respond quickly to acupressure due to their vibrant qi and less entrenched patterns of imbalance. It's a comforting and empowering tool for parents. For sleep issues, gently pressing HT7, Heart 7 on the wrist, or Anmian points behind the ear can help calm an overactive child and promote restful sleep. For colds and congestion, Li4, large intestine 4 on the hand, and Yintang between the eyebrows can help clear nasal passages and ease breathing. It is crucial to make the experience pleasant and playful for children, avoiding any discomfort. Always observe their reactions and stop if they show signs of distress. Acupressure for children should always be approached with extreme gentleness and an understanding of their unique physiology. Consulting a pediatrician before starting any new therapy is always advised. Self-acupressure techniques. Self-acupressure is an empowering practice that allows individuals to take an active role in their own health and well-being. It involves applying pressure to acupoints on one's own body to alleviate symptoms, reduce stress, and promote relaxation. The key to effective self-acupressure is accurate point location and appropriate pressure application. Using thumbs, fingers, or even knuckles, one can target points for common complaints like headaches, fatigue, or indigestion. It is a convenient and accessible method, requiring no special equipment, making it ideal for daily practice or on-the-go relief. Regular self-acupressure can significantly enhance overall health and vitality. To perform self-acupressure, find a comfortable position, take a few deep breaths, and gently locate the desired acupoint. Apply steady, firm pressure for 30 seconds to several minutes, or until you feel a dull ache, warmth, or tingling sensation. You can also use a circular massage motion. It is important to listen to your body and adjust the pressure as needed. Common points for self-care include Li4 for headaches, PC6 for nausea, HT7 for anxiety, and ST36 for energy and digestion. Incorporating self-acupressure into a daily routine, such as during a morning meditation or before bedtime, can yield profound benefits for both physical and emotional health. It is a powerful tool for personal wellness management. Acupressure for emotional balance. Acupressure is a powerful modality for promoting emotional balance and well-being by regulating the flow of qi and calming the spirit. Many acupoints have direct connections to emotional states, as understood in traditional Chinese medicine, TCM. For instance, the liver meridian is associated with anger and frustration, while the heart meridian relates to joy and sadness. By stimulating specific points, practitioners can help release stagnant emotions, soothe an agitated mind, and cultivate a sense of inner peace. This holistic approach recognizes the deep interplay between physical and emotional health. It offers a gentle way to process and release emotional tension. Key acupoints for emotional balance include HT7, Heart 7, or Shenmen on the wrist, which calms the spirit and alleviates anxiety and restlessness. PC6, Pericardium 6 on the inner forearm, helps to relieve emotional constriction and nausea associated with stress. CV17, Conception Vessel 17, the Sea of Tranquility, on the breastbone, is excellent for releasing suppressed emotions and chest tightness. LV3, Liver 3, on the foot, helps to smooth the flow of liver qi, reducing irritability and anger. Regular application of acupressure to these points can foster emotional resilience, promote mental clarity, and enhance overall emotional harmony, leading to a more balanced and peaceful state of being. Contraindications and precautions. While acupressure is generally safe, there are specific contraindications and precautions that practitioners must be aware of to ensure client safety. Acupressure should be avoided over open wounds, bruises, rashes, varicose veins, or any areas with skin infections. Direct pressure on tumors, fractures, or areas of acute inflammation is also contraindicated. For individuals with serious medical conditions, such as heart disease, uncontrolled high blood pressure, or cancer, it is crucial to obtain clearance from their primary healthcare provider before administering acupressure. Certain points are also contraindicated during pregnancy, especially in the early stages, as they can induce contractions. Always prioritize client safety and well-being. Special precautions are necessary for sensitive populations. For pregnant women, points like Li4, SP6, and BL60 should be avoided or used with extreme caution and only under the guidance of an experienced practitioner, especially in the first trimester. For individuals with diabetes, neuropathy, or bleeding disorders, pressure should be very gentle to avoid injury or bruising. Elderly clients and very young children also require lighter pressure and shorter treatment times. It is imperative to always take a thorough health history and conduct a careful assessment before beginning any acupressure session. When in doubt, always err on the side of caution and refer to a medical professional. Clear communication with the client about any discomfort is also vital. Hygiene and client care. Maintaining impeccable hygiene is paramount in acupressure practice to ensure the safety and well-being of both the practitioner and the client. Hands should be thoroughly washed with soap and water or sanitized before and after each client interaction. Any tools used, such as acupressure sticks or rollers, must be cleaned and disinfected between uses. Linens, towels, and pillowcases should be fresh for each client, or disposable covers used. This prevents the spread of bacteria, viruses, and other pathogens. A clean and sanitary environment instills confidence in the client and reflects professionalism. Adhering to strict hygiene protocols is a non-negotiable aspect of responsible practice. Beyond physical hygiene, client care encompasses creating a comfortable, respectful, and confidential environment. This includes ensuring privacy during sessions, actively listening to the client's concerns, and explaining the treatment process clearly. Obtaining informed consent before each session is crucial, ensuring the client understands the procedure and agrees to it. Maintaining professional boundaries and respecting cultural sensitivities are also vital. Providing a warm, quiet, and aesthetically pleasing space contributes significantly to the client's relaxation and therapeutic experience. Excellent client care builds trust and fosters a positive healing relationship, making the acupressure session more effective and enjoyable for everyone involved. Ethical considerations. Ethical practice is fundamental to building trust and maintaining the integrity of the acupressure profession. Practitioners must adhere to a strict code of ethics that prioritizes the client's well-being above all else. This includes maintaining confidentiality of all client information, respecting their autonomy, and always acting in their best interest. Avoiding conflicts of interest and refraining from making exaggerated claims about the efficacy of acupressure are also crucial. Practitioners should clearly communicate their qualifications and limitations, ensuring clients have realistic expectations. Upholding these ethical standards protects both the client and the practitioner, fostering a respectful and professional relationship. Professional boundaries are another critical ethical consideration. Practitioners must avoid dual relationships that could compromise objectivity or exploit the client. This means refraining from engaging in personal relationships with clients or providing services outside the scope of their training. Clear communication about fees, cancellation policies, and treatment plans is also part of ethical practice. If a client's condition is beyond the scope of acupressure, an ethical practitioner will refer them to an appropriate medical professional. Continuous professional development and adherence to legal and regulatory requirements are also essential for maintaining high ethical standards throughout one's career. Ethical conduct is the bedrock of a reputable and trustworthy practice. Building a professional practice, establishing a successful acupressure practice requires more than just clinical skills. It involves strategic planning and business acumen. Key steps include developing a comprehensive business plan, securing appropriate insurance, and understanding local licensing and regulatory requirements. Creating a professional brand identity, including a logo and consistent marketing materials, is essential for attracting clients. Networking with other healthcare professionals and building referral relationships can significantly expand your client base. Offering clear pricing structures and flexible appointment scheduling also contributes to client satisfaction and retention. A well-thought-out business strategy is crucial for long-term success. Marketing and client retention are ongoing efforts. Utilizing a professional website, social media, and local advertising can help reach potential clients. Offering introductory workshops or free consultations can also generate interest. Providing excellent client service, including follow-up communication and personalized care, encourages repeat visits and positive word-of-mouth referrals. Continuously seeking feedback and adapting your services to meet client needs will foster loyalty. Investing in ongoing education and specialization can also differentiate your practice and attract a niche clientele. Building a thriving acupressure practice is a journey that combines therapeutic expertise with sound business management. It requires dedication to both healing and entrepreneurship. Integrating with other therapies, acupressure as a complementary therapy can be effectively integrated with various other healing modalities to enhance overall client outcomes. Combining acupressure with massage therapy can deepen relaxation, release muscle tension, and improve circulation, addressing both energetic and physical blockages. When paired with aromatherapy, the therapeutic effects of essential oils can amplify the calming or invigorating properties of specific acupoints. For clients undergoing physical therapy or chiropractic care, acupressure can support pain management and accelerate recovery by reducing inflammation and promoting tissue healing. This integrative approach often leads to more comprehensive and lasting results. It acknowledges the multifaceted nature of health and healing. Furthermore, acupressure can complement practices like yoga and meditation by enhancing body awareness and promoting deeper states of relaxation. It can also be used alongside conventional medical treatments, providing symptomatic relief and supporting the body's natural healing processes without interfering with medications. For example, acupressure can help manage side effects of chemotherapy or reduce anxiety before surgery. When integrating therapies, clear communication and collaboration with other healthcare providers are essential to ensure a cohesive and safe treatment plan. This holistic perspective allows for a more personalized and powerful healing journey for the client, leveraging the strengths of multiple modalities. Research and future of acupressure. The field of acupressure is continuously evolving, with ongoing research contributing to a deeper understanding of its mechanisms and efficacy. Modern scientific studies are exploring how acupressure influences the nervous system, releases neurochemicals like endorphins, and affects blood circulation and inflammation. Functional MRI scans are being used to observe brain activity changes during acupressure stimulation, providing empirical evidence for its therapeutic effects. This scientific validation helps bridge the gap between ancient wisdom and contemporary medicine, fostering greater acceptance and integration into mainstream healthcare. The future of acupressure is increasingly supported by evidence-based practice. Technological advancements are also shaping the future of acupressure. Wearable devices that provide guided cells acupressure, smart mats with pressure sensors, and virtual reality applications for learning acupoint locations are emerging. These innovations make acupressure more accessible and personalized. Furthermore, research is expanding into new applications, such as postoperative recovery, sports injury rehabilitation, and mental health support. The integration of artificial intelligence and big data analytics could also lead to more precise and individualized treatment protocols. The future of acupressure promises continued growth, innovation, and a broader role in holistic health and wellness, driven by both scientific inquiry and technological progress.